Hey there, welcome back to How to Medicate and welcome to this new video on how to use Clonazepam. This video is part on a video series on mental health problems, and for those of you interested, check out the playlist in the description after watching this video, of course. For those I'm meeting for the first time, my name is Raoul. I'm a medical doctor from the Netherlands and I'm making weekly medical videos to educate myself as well as you, my viewer, because I believe that medically educated people make healthier decisions, which is the whole point of this channel and this video. This video also comes with a quick disclaimer. It's meant purely informative. This is not medical advice, and if you're looking for medical advice, always contact your own doctor. And now quickly, let's get started. Now, the generic name of this medication is Clonazepam, but it's sold under several brand names like Klonopin and Rivotril, and it's available as tablets, drops and injections. Which brings us to how to use it. If you want to use it as a tablet, make sure to swallow it whole with half a glass of water. If you want to take it as drops, add the right number of drops to a spoon and mix it with some water and then drink that water. And if you want to take it as an injection, your nurse or your doctor will administrate it. Considering the duration of use, it's often strongly discouraged to use Clonazepam for more than several weeks straight, as this can increase your risk of becoming dependent on this drug. This means you could get withdrawal symptoms when you stop taking it, therefore always discuss prolonged use with your doctor. Now, Clonazepam itself is part of a group of drugs called Benzodiazepines, and this can be used to reduce symptoms of several medical conditions like epilepsia, panic disorder, social phobia and muscle cramps. Which brings us to the correct dosages to use. And here is important, you always use the specific dose and frequency your doctor gave you, as dosages can differ a lot depending on your specific indication of use, your symptoms, the severity of your symptoms and the side effects you're experiencing. Therefore, I can only provide you with some guidelines. When treating epilepsia in adults, your doctor might prescribe an initial oral dose of 1 to 2 milligrams per day. This then can be slowly increased up to a maintenance dose of 2 to 4 milligrams a day. And ultimately, the maximum dose would be 20 milligrams per day divided over several dosages. In addition, Clonazepam can have some severe side effects. I will discuss some of the most common ones in this video, but if you're looking for a complete list, ask your doctor, check your leaflet or ask your pharmacist. Uncommonly, it can cause drowsiness and fatigue. Rarely, it can cause slurred speech, difficulties concentrating, slow thinking, memory problems, double vision and balance problems. And very rarely, it can cause nausea, diarrhea, incontinence, difficulties breathing and a seizure. Which brings us to the safety of use. First of all, be careful to combine Clonazepam with alcohol, as this can increase its side effects, cause you to be dizzy, confused, so please be careful. Next up, be careful when driving, as Clonazepam can cause dizziness and a decreased alertness. If you experience any of these side effects, then please do not drive, as this is not safe. And lastly, Clonazepam can have some interactions with the other drugs you're taking. Therefore, always discuss this with your prescribing doctor. As you know, we always ending these videos off by taking a look at the safety when pregnant or when breastfeeding. And research shows us that Clonazepam could be dangerous in both cases. However, there are some exceptions, so always discuss these with your personal doctor. Now, I hope you know now how to use Clonazepam, but if you have any questions, let me know in the comment section below and I will do my best to answer each and every one of them. For those of you that want to keep on learning, check out the playlist in the description. And if you did learn something and if you did enjoy the video, please leave a like. This will help out the channel tremendously and consider subscribing. I'm trying to reach 100,000 subscribers before the end of the year and you can help me reach that goal and educate yourself along the way. Thank you all for watching. A special thanks to my Patreon subscribers, mainly Sebastian, who's an investor tier subscriber. And for those of you that can't get enough, also check my Instagram account @HowToMedicate. I'm posting there a few times a week. See you all next week with a new video. Bye bye.